candidates to
Yes.
so the recording will be,
Rachel, sorry, can you remind us where the materials are for this meeting? I don't see them in the meeting invite. Is it an email
yes, I sent it is an email.
from you?
I think it came from Audrey, but from like the cost board inbox. You guys should have received yesterday.
I'll resend those now to the folks on the call.
Thank you. I'm searching by Audrey.
Yesterday at 4:38, HCA HCCT board
Okay,
at
great.
4:38.
Thank you. I'm looking for it now. Got it.
Yeah, sorry those materials got out late. We were waiting for some of the attachments to put into the appendix for you guys to review. So this meeting is being recorded. The recording will be posted on the committee's webpage after the meeting for everyone's reference. Today's agenda can be found under the first tab in the meeting materials. And welcome, committee members. It's now 8:35, and I called October 2nd nominating committee meeting to order. And today's agenda, we'll do the roll call, public comments, and then we will review nominations. We have 5 nominations to get through today, 1 for the Primary Care Advisory Committee and 4 for the Stakeholder Advisory Committee. And then after each nomination, we will do a vote to see if we would like to bring those nominees as a recommendation to the cost board. And then we will wrap up and conclude today's meeting.
Let me ask you a question first. I think I didn't understand, so I want to confirm that we have these 5 nominations. And can you confirm the number of seats that we're actually placing people in?
Yes, I have a slide for that to show you guys.
I think maybe I didn't understand that slide for some reason, but go ahead. Thank you.
Okay. No, that's a good question. Okay, so I'll do quick roll call just for meeting minutes, just to capture. Carol, here. Ingrid.
Here.
And Kim.
Here.
Okay, and then public comment. Let me see if we have any other people. No, it doesn't look like we have anybody else on the call, so we will close public comment and then move to the nominations.
Do you want us to approve the minutes, or is that a consensus?
Yes, no, I'm sorry.
Worries?
I skipped ahead.
They looked good to me, and if anybody else had Kim, if there was anything that you saw there that we needed to change, it looked good.
No, if you're moving to approve the minutes, I second.
Perfect.
So Carol moves and then Kim seconds. Thank you. So the meeting minutes from the last nominating committee meeting from January is approved.
And just no concerns. Everyone is in favor of the meeting minutes.
Correct.
Okay.
Yes.
Thank you.
Okay, for the nominations. For the Primary Care Advisory Committee, we don't have a set number of committee members that are required to sit on this committee, but we have recently lost 4 members this past year. David DiGiuseppe, Meg Jones, Sarah Stokes, and Sharon Alaranta. And this is either they have retired or resigned from these positions. And so we have 1 nominee that is interested in joining the Primary Care Advisory Committee that we will be reviewing now. So Elizabeth Hutchinson, she is a medical doctor. She is a primary care physician at UW, focusing on primary care since January 2021 through present. She manages a panel of 1,250 patients 3 days a week. And Some of her areas of special interest include women's health, pediatrics, substance use disorders, mental health. And she's interested in joining the primary care advisory committee. We got her statement of interest late, so it did not make it into this packet, but we will send out a revised packet so you guys have an opportunity to review her statement of interest if you'd like. We did include her CV in the appendix for your reference, so you could see that. This is just a quick bio that gives you a quick snapshot of her background and experience.
Are you able to display the statement of interest?
Yes, we can. I am not screen sharing. Let me. Ross,
Sure.
do you have a statement?
Yeah, I'd be happy to bring up the statement of interest. Apologies, we got this late yesterday. Elizabeth,
yeah, I noticed that there wasn't one, and I thought, oh gosh, I hope it's always good to hear from the person, that they actually want to do this. I think that's meaningful, and because people tend to have lots of very impressive credentials, but that doesn't necessarily mean that they're eager to participate.
that is
Tim,
very
thanks. I agree also. And I so apologize. I missed our last meeting. It would also be helpful to see the context of who the current participants in the primary care advisory committee, just as we think about balance, and thinking of folks in primary care, as well as, people who represent different types of practices, including physician-owned independent practices. Just wanting to see the balance.
Okay. Yeah, we are updating all of our committee member rosters, and we will have that for the cost board meeting on October 23rd, so we can see the full list of current members sitting on each committee.
I'm going to send it to you, Audrey, and then you can bring that up. Sorry, yeah, I tried sharing it, wouldn't let me. And while Audrey is bringing up the statement of interest, we can also, just to let folks know, Elizabeth is also interested in participating in the primary care cost board, which doesn't get handled through the nominating committee. There's a governor appointment process, so we'll encourage Elizabeth as well to submit her application for the governor's office consideration for those positions. Let's see if I can get a screen share going while
Allow you to take.
no.
I could make a comment while you're doing that, Ross. I could make a comment about Dr. Hutchinson. I noticed that I thought it was notable that she was repeatedly apparently voted as Teacher of the Year by residents. And I think that I don't know, that struck me, as really noteworthy, because I think that speaks to engagement. It speaks to a person's sort of that they're why why that they really are not only interested in their well-being of their patients, but they're really trying to support and promote and enhance the practice of primary care and family practice. That so I think in giving investing in that the future strengthening, of primary care, and kind of putting their money where their mouth is, and really showing up to promote high quality practice and clearly is engaging to the residents. So I thought that jumped out, and people have lots of impressive credentials, but I think sometimes you can get insight, little kernels of insight, about how someone will show up into an appointment like this.
That's a great comment. Thank you, Kim.
And apologies for interjecting again, just for a little more background while we're putting up this statement of interest on the screen. David DiGiuseppe, one of the former members, is who kind of forwarded Elizabeth to us, and we just had a quick chat with Elizabeth, and has not had any prior policy experience, which I found very interesting and appealing in a sense, coming at more of this policy-focused body, kind of with some fresh eyes, and I thought that was really interesting and seeking ways to advance primary care in particular was what she noted to us. And so we're currently sharing that statement. So I'll shut up for a minute and let folks read that, and then we'll bring up the current primary care roster for you folks.
I think we're, Rachel, we're only seeing a couple paragraphs of that document. Okay. And thank you. I really appreciate Ross's comment. It's helpful to know how people were recommended to serve on the board. Had a chance to review. Thank you.
Yes, and now we will bring up that current the roster, acknowledging that some of these are now vacancies. And Audrey, if you could just scroll up slightly. Perfect. Oh, okay.
This is helpful. Thank you. And I'm wondering with the other nominating committee members, what kind of balance we're hoping for and the composition of these committees. I'm seeing we already have 2 representatives from UW on the primary care group.
DC is not on the committee anymore. He resigned, I think it was the end of last year. So we have to update this. Judy and I were trying to go through together to update to make sure that we do have that balance. And she did note that we need she was hoping to have somebody that has pediatric experience. So that was one of the things that did stand out about Elizabeth's.
Thank you. That's helpful. And I'm thinking, love the recommendations on what kind of experience is missing, as well as looking at diversity in representation across geography, across provider, carrier, and then within the provider community, independently owned versus part of a large system. So, I think for us as a nominating committee and with my colleagues on this committee, that would be helpful data points as we see people who are recommended, who they're recommended by, what's the expertise that's missing that we're looking to fill in the group, and how does that impact the balance of diversity across what I just mentioned, as well as racial diversity and bringing other lenses to this work.
That's helpful information for us. Thank you.
If from what I understood, she is from her expressed interest looking also to serve on the board. You can serve on the board and a committee, correct?
Yes.
Okay. I'd hate to have a short-term appointment to a committee if she was to be appointed to the board. So
Yes.
well, it looks like the expertise is certainly a balancer. It would be then make 2 representatives from the UW, I believe, if the scroll back to the top of the page. Yes. But there's also 2 from other organizations as well, like Confluence, and I think trying to do quick math is with a scrolling screen is tough.
Yeah, that's my count as well. Carol is two current folks. With DC now not being actively on the primary care committee.
Right.
And Ross, do you feel like there's good enough geographic representation from the central and eastern side of the state on this committee? I'm seeing some, but we can't see the whole screen at the same time, so it's hard to do that kind of quick analysis.
I think that was another area of focus that Judy did say. She is hoping that we would be able to identify, as we've lost 4 members recently, and we are looking to hopefully fill those vacancies, being cognizant about that we do need more representation from Eastern Washington. She had a few categories. It was that, and then also pediatrics. And I'm trying to remember the other categories. So those were different things that we were trying to balance in terms of how to identify potential candidates to fill those vacancies.
It looks like behavioral health is also missing from this committee. Especially, it's not overt. And Elizabeth has that interest as well.
Yeah, that's a good point, Carol. Thank you.
Right. And by Carol, when you say behavioral health, are you including mental health?
Mental health and substance abuse.
Yes, yes, yes. I mean, yes, thank you.
She has
Sometimes
both
people use
interests.
different words to, mean different things. So thank you.
Yeah. Yep.
I agree. I think that's a key perspective.
I would be in favor of moving this person forward, particularly with our expressed desire that the 3 other open positions. I don't think there's a number of positions you said that's a limit on this committee, but a greater statewide representation. But for a specialty need for this committee, it seems like she's feeling a very good need from this group.
Okay, so Carol would like to make a motion to recommend Elizabeth as an advisory committee member to the primary care committee. Is there a second?
I will second that, just with an amendment on process that we just learned from this conversation. That going forward, we need more data on the balance of representation and the recommendation. But I will support this one and hope that we can just be more prepared to evaluate not just the individual, but the impact on the composition of the entire group.
Okay, that makes sense. Thank you, Ingrid, for the feedback. Okay, all in favor of nominating Elizabeth, say aye.
Aye.
Any opposed? Okay, thank you. So approved by consensus, and we will bring her to the October 23rd cost board meeting. And then
Rochelle, I apologize. I just real quickly, I'd like to just go over with Ingrid, just to make sure, because I like these recommendations, Ingrid, that I'm understanding sort of what you're looking for in future nominating committee, at least background information. You'd be interested in knowing who recommended the individual in scenarios where there is a recommender. They can obviously apply on their own. If there's already representation from the entity that that individual is employed with or associated with, some idea of geographic representation, if they're part of, more of a rural community or an urban community, and how that balances out current membership, and then equity considerations. Does that sound like some of the factors that would be helpful to provide in the meeting packet moving forward to kind of provide some context around these?
Ross, yes, absolutely. Thank you so much. I would just only include also the recommendation of the chair of these committees.
Okay.
So hearing like from Dr. Judy, and I think from the stakeholder advisory that we're just about to discuss, I believe is Eileen Cody. So seeing the current composition and then some analysis of expertise that's missing, that we need for balance in this group. We are seeking more representation from the, whatever both individuals expertise as well as who what stakeholder they're representing and their geography and equity considerations. Just helps to see the whole rather than just if we just see one candidate, it's sort of in isolation. It doesn't and I so apologize. You all may have covered some of this in your last meeting that I missed.
No,
Yeah,
some of the same things were expressed in grid at the last meeting, so.
Yeah. So I guess the question is with the stakeholder advisory committee, rather than moving forward to just look at individuals in isolation, do we have any of that analysis or around composition and expertise for this group before we move into being asked to vote on specific nominees?
For the stakeholder advisory committee, there are
Specific, yes.
right. And so those are the ones that we're looking at to fill is the vacancies that need to be sent to us by particular nominating entities.
Is there a screen share of the total group composition to date, that just for context?
Yes, we do have a stakeholder advisory committee roster. It's just not.
I can also Google it.
Yeah, it's not completely up to date. Let me see.
Audrey, I'll send you the link if you could maybe just share this screen. To...
Oh, you got it, Ross?
Yeah, I also think I just pulled it up myself as well. And maybe screen sharing is hard, so I don't know for other members if you want to just share the link. It's a little easier to look at.
Of course, I will drop that in the chat.
Yeah.
Thank you, Ross.
Yeah.
For sending no review.
This is helpful to see the committee members. It doesn't the composition,
Yeah.
The directed specific composition of this committee is not illustrated on the website. I don't know if is there a reminder of that?
I do have, I'm not sure if I have a document that's readily accessible for the stakeholder committee in terms of the exact positions. I think we have it on the website, but that's not something that we have ready right now, Ingrid. I apologize.
It's okay.
Okay, so what we're looking at from the webpage is the roster, essentially.
Mm-hmm.
The name. Okay.
Just the names, not the are all the seats on this advisory committee dedicated to a specific nominating entity?
Yes.
Well, it's a broad-based for the stakeholder. If you at the statutes RCW 7390040 sub 3 and then A through P elucidate the different individuals that the legislator specified that we need to have. So one comes from Washington State Hospital Association, Washington Association for Community Health, Medical Association. So these are primarily coming from entities who are nominating a individual from their association or group.
Okay, so these the nominees that we're considering today are being nominated by the by various nominating or sending groups for specific slots for specific seats to fill their seat, so to speak. Is that correct?
Absolutely. So, for example, for Washington Hospital Association, who I believe is on this list, one member representing hospitals and hospital systems selected from a list of 3 nominees submitted by the Washington State Hospital Association.
Right.
Similarly, for the Medical Association, one physician selected from a list of 3 nominees submitted by the Washington State Medical Association. So this is much more narrow criteria than when we're discussing with primary care.
Thanks, Ross. That's helpful. So when you look at the current roster, looks like WISMA has a dedicated seat on this group. Who's the current WISMA appointee, or is this vacant?
That one was from Washington State Medical Association, was Dr. Hishmati, and he sent in his resignation letter that he's no longer going to be able to serve on this committee. So that is what prompted us to reach out to Washington State Medical Association and let them know we need additional nominees to fill this seat.
And how many did they nominate?
They nominated
for our consideration.
They nominated 1. So they are supposed to send a list of 3, but unfortunately they only had interest from 1 physician. So we will review 1 from Washington State Medical Association, and we do have 3 nominees from Washington State Hospital Association.
Thank you. And Kim, yeah, just process wise, and this works with a lot of these board and commission recommendations, is like, for example, on my board, each caucus of the legislature is directed to submit a list of 3 to the governor. So we're familiar. It's just a familiar structure. Mm-hmm. So it is, it's preferable if the recommendation of presenting a list of 3 and then we choose 1 is followed.
Yeah, we did reach back out to WISMA, and they thought that they chose to submit 1. So we wanted to bring that to you, as there is a vacancy, but we acknowledge that we did not get 3 recommended.
Do we know if there's due diligence and outreach by WISMA to generate a list of 3? Because who they're proposing, I not in any measure a judgment of the individual, but it is the president of their association. And were there others, or did others know of this interest in serving?
They had a board meeting or a leadership meeting where they discussed this, and they did outreach, and this was the nominee that was interested in serving in this capacity.
Great, thanks for that additional background.
Yeah. Okay, so for this slide, just like we were talking about, these are the 2 seats that we are going to be reviewing today to fill. So the first one, as mentioned, is Washington State Medical Association, and the 1 nominee we will be reviewing is to fill the seat left vacant by the resignation of Dr. Hishmati. And then the other one is the vacancy once Eric Lewis resigned from Washington State. He was with Primera Blue Cross, nominated by Washington State Hospital Association. So those are the nominees we'll review. Next slide. Okay, so first we'll start with the Washington State Medical Association nominee, John Bramhall. He is a medical doctor with his PhD, and as you mentioned, he is the associate medical director. And we have his CV, full bio, and statement of interest in the appendix for your reference, so you can see additional information. And he's the immediate past president of WISMA, and currently chairs the Washington State Medical Association Executive Committee. So I will open it to you all for a brief discussion about John. And then we can move to a vote or next steps regarding his candidacy for this membership position.
What's the timing, Rachel? Like, is there, is it urgent that we make a decision on all these nominations today?
No, it's not urgent. We are trying to fill these positions to the best of our ability. But if we feel like the nominees that are brought to us are not a good fit, we can always go back to Washington State Medical Association, let them know that we are hoping to get additional nominees. Right now, Jeb Shepard is serving as an interim committee member on this committee, a non-voting interim committee member. That way, we do still have representation. He's just not able to vote in any capacity on that. So we do have a voice at the table, but we are looking to fill this if possible. So,
well, I have two thoughts with regard to this nomination. Dr. Bramhall, clearly has a very extensive and deep background in medicine. And I will note that I think it seems that he's very engaged in the Washington State Medical Association and familiar with sort of representing, through WSMA, physicians and surgeons in Washington State and their interests and everything. And so, that stands out, that he has a record of engagement and participation, which is excellent. I do have a hesitation, so it's not really with respect to Dr. Bramhall. The hesitation is about the lack of all other candidates to consider nominees. So I guess I would be interested, in Ingrid and Carol, if what you feel, I would support not taking action on this particular nominee today. But with a note that, clearly, he is a highly, experienced and qualified and engaged individual, apparently, from the information that's provided. So it's not a comment on his qualifications, but more a seeking to be as thorough and as representative as possible.
thank you, Kim.
I concur with the recommendation of just deferring action to respectfully give Washington State Medical Association more time to produce two other individuals as well. As that we are just discussing, we're seeking a diversity both across geography and equity and profession. And it would, I think, just respect the process, not rejecting Dr. Bramhall, but requesting that WSMA take a little more time to present three recommendations.
Okay, so just make sure I'm capturing this correctly for our meeting minutes. Kim made the motion to defer and Ingrid seconded that. And just, are you guys all in favor, Carol?
Yes.
Okay, thank you. So we'll reach back out to Washington State Medical Association, let them know the updates that came out of this nominating committee meeting and see if they do have additional nominees they want to bring to us, or at least let them know that they have more time to find those additional nominees. And then if and when that does happen, then that will be brought to the next nominating committee meeting at the beginning of 2026. So thank you. And now we can move on to the next.
Michelle,
Yes.
just want to make sure that in your summary of passing this along to Wisha, that this was not a rejection of Dr. Brammel's nomination. We would just like to see at least two additional nominations.
Right. We will
Okay.
make that. Yeah, it's not a rejection, just making sure that you have the ability to review 3 nominees and select as it does indicate.
Yeah, out of respect for the process, I really liked that wording, Ingrid. Thank you.
Yeah, thank you.
And apologies for interjecting again. Just one point of clarification. If we are unable to get 3 candidates, would the committee's preference be that we withhold bringing this back until there are 3 candidates, or if after further request we still receive 1 candidate, that candidate be brought back to the nominating committee?
I'm being pausing to defer to my committee members, but I would say the latter is like a good faith effort. And I know it's hard because you're asking people to volunteer for an intense activity that's important. And these are busy professionals. So I want to be respectful of that, but just ask them to please take a good faith effort to produce 2 additional candidates.
Yeah, agreed.
Thank you. That sounds great. And we can try, if we don't are not able to receive an additional 2 members, maybe we could try and get a statement and bring that back to the committee for your consideration if we don't get all 3. Thank you.
Thank you. Now we'll move on to Washington State Hospital Association. So we need to select 1 of the 3 nominees from this list here. Jason Hotchkiss, Katerina Lamarche, and Jennifer Bracking. And I want to mention that Wisha did indicate their preference would be Jason, just based on his experience. Next slide, please. Okay, Jason Hotchkiss. He's the Chief Financial Officer at Great Falls Clinic Hospital in Great Falls, Montana. Former Chief Financial Officer of Multicare Health Systems in Tacoma, Washington. And he has experience working at a hospital located in Spokane, Washington. Graduated from Western Washington University. So I can give you guys a moment to discuss, or we can move on to the next candidate so you have an opportunity to review all 3 and then have a discussion. Whichever you
technical question. Do the nominees, are they required to be Washington State residents? And if so, is Jason a Washington State resident? Looks like he works in Montana.
That's a good question. It does not indicate anywhere that they have to reside in Washington. And I do see your point. It does look like he
I mean, I don't know, but you can live and work in different places, but it's just a curiosity.
Right. Yeah, I'm not 100% sure on where he resides. But we do know that he's currently working in Montana.
And there's nothing in the statute that specifies Washington residents, but would be happy to ask that question to the specific nominee if that would be helpful point of clarification.
Thank you.
I can double check his resume really quick. I removed all personal details when I included that in the packet. So I could just check to see if it does indicate on his resume, just real quick, for your reference. It does say Cheney, Washington. So it looks like he might live in Washington, but works for a hospital in Montana.
Thank you for the clarification. Unless the other committee members have questions, I'm happy to move on.
I had a question. I did look at the resume, but I could reuse a refresher. I'm looking at the second and third bullets, and I'm seeing Chief Financial Officer, Multicare Tacoma, that's headquarters, I assume, you know, the same dates or overlapping dates with experience working at the tertiary hospital in Spokane. And the word experience doesn't specify the his role. So could you look that up real quick and because I'm just trying to understand the
Yeah,
experience at the Spokane Hospital for 3 years that directly overlapped with being CFO for Multicare. And it seems that
would you,
CFO of Multicare would be a full-time job.
right. Audrey, would you mind going to the appendix and pulling up Jason's just so we can screen share? There we
There,
go.
I'll make it bigger so I can see. Yikes. Okay. So can you go to the time period to 2019 through 2020 in oh, I see. Scroll down a little bit more and let's get to the 2019 there, right there. Okay, so let's see. From Tennessee, okay, and then uh scrolling up would be the time in Tacoma, I think. Early 2019. Um, oh, did we miss something there from about April of 2019?
Yeah, I think it's the bottom one right there where it says Chief Financial Officer
I,
in Spokane, Washington.
oh, okay, I couldn't see that. Okay. Oh, Deaconess. I see. So, oh, CFO Deaconess. I see. And then CFO Multicare Health Systems. I was just confused about there was an additional bullet on that slide that said CFO Multicare Health Systems Tacoma that
Okay.
started in April of 2019.
I think it might just be an error on the slide. The resume seems to track
Right,
dates and sequence, Kim.
right.
I
More
think it just,
specifically, exactly, at Deaconess.
yeah, and then interim CFO
At a
and
different,
at Multicare from 22 to 23.
yeah,
And then there's a
regional.
sequence there that tracks, and I think there was maybe
Exactly.
just an error on the PowerPoint. So
Yeah, on the first page of the resume is where it says multi-care health system Tacoma. The first page.
Right.
Uh,
Okay, I
there's
understand.
oh yeah,
Affiliation.
yeah.
yeah, yeah.
Okay, thank you. Uh
Definitely gets around.
let's see. Over. Okay, thank you. Thank you. Yes. That starts to put the pieces together. Thank you.
Do you want us to move on to the next nominee, Katarina LaMarche? Or do you guys still want to review his CV?
I'm ready to move on.
Okay.
Carol, Ingrid?
Yes.
Yeah, ready to move on. Thank you.
Okay, the next nominee is Katarina LaMarche. She's currently serving as the policy director for Washington State Hospital Association. She formerly worked as a policy analyst And that should, the abbreviation there should say WS instead of WA. So Washington State Hospital Association. I think that was a typo. Experience working with state officials to improve healthcare. And she worked at the Social Security Administration as an attorney advisory and graduated from UW, and then also went to Pace University School of Law. And her CV is also in the appendix for your reference and review.
I had no questions on this one. It's pretty
Okay.
self-evident.
No questions. Thank you.
Okay. And then we can move on to the third and final nominee, Jennifer Brackeen. She is currently the Senior Director of Government Affairs at Washington State Hospital Association as of April 2025, former Director of Innovation at Summit Pacific Medical Center. And she worked at Choice Regional Health Network as a manager and also in a director capacity for nearly 7 years. And she graduated from University of Washington with her master's in health administration. And her CV is also in the appendix.
And just as a reminder, this is, again, one member representing hospitals and hospital systems selected from a list of 3 nominees submitted by hca. Just to remind folks.
Had no questions on this Jennifer Brackeen either. To me, of the 3 applicants, Jason Hotchkiss is a wealth of experience in various hospital systems across the state. And if there isn't a concern with regard to not working currently in Washington State, but residing, it appears, in Washington State, and from hca itself, it was their recommendation. I am agreeable to supporting that recommendation.
Thank you, Carol, for making a motion to recommend Jason. Is there a second?
It was more of what I was feeling rather than yet a motion. We hadn't heard anything from Ingrid or Kim, so I want to make sure I give them.
Thank you.
Sorry.
Oh, thanks, Carol. Appreciate it.
Thanks for clarifying.
Yes.
Yes, Carol, just I hear you, and I was sort of leaning more on recommending Katerina. She's very familiar, deeply familiar with the work of the Healthcare Cost Transparency Board. Provides a broad background and less of a niche expertise in the CPA, the fiscal side. So I think she has been is familiar with the work that's happening and has a proven commitment to participating frequently in the meetings already. And more of a varied background on health, more broadly on health system and healthcare reform versus bringing that more just very focused CPA and fiscal focus.
Mm-hmm. Mm-hmm. Those thoughts resonate with me as well. Ingrid, I appreciate that. And I could fully back that as well.
Could we, oh, well, we're running out of time. Could we look very briefly at Katerina's resume? I mean, we've heard from Katerina, I think and so Ingrid, as you're pointing out, Katerina is certainly, you know, very engaged and knowledgeable and articulate policy partner. I just wanted to look real quickly here to recall specific experience.
And while folks are reviewing, just reading from Katerina's correspondence, not sure if it carries any weight, but our preference would be to have Jason be our rep, since he's the only person with the best experience that we're able to recruit. And I did note to Kat that ultimately this is up to the discretion of the nominating committee, but just wanted to make sure I was reiterating that information.
Can you scroll down a little bit? I'm watching the time. I see that we're at 9:25. Okay. Gosh, they're very different, right? They really, on paper at least, I can't comment on their contributions, the contributions they would make specifically as individuals.
I know we're running out of time, so I'm just a final comment. I could go either way. I think again, the stated preference for Katerina is familiar with the work, broader background in healthcare system transformation, population health. Also her previous engagement with the Healthcare Cost Transparency Board. Jason looks great as well. Just noting that he's currently a CFO at a hospital in Montana.
Right.
And that also very much bringing that CFO perspective. And personally for me, even though we are looking at healthcare cost containment, is like seeing the big picture, the bigger picture beyond the fiscal side of the issue is important. So not a strong preference, but definitely that would be my preference. And I understand that Wisha has recommended Jason, but clearly they must feel good about all three.
Yes.
Go forward.
Right. Yeah, I think that given that the Healthcare Cost Transparency Board, albeit has cost in its name, is a really major policy effort. And it's pretty far-reaching and impactful in ways that are not limited to cost. So I would I guess in first position for me would be Katerina.
Okay, would someone like to make a motion to recommend Katerina?
I move that we accept the nomination and recommend to the board Katerina LaMarche as the Washington State Hospital Association representative to the Stakeholder Advisory Committee.
Thanks, Kim. Is there a second?
Second that.
Thank you, Ingrid. All in favor, say aye.
Aye.
Thank you. Approved by consensus, and Katerina will be brought to the next cost board meeting as recommendation from the nominating committee. And that brings us to the end of today's meeting. We will bring these nominations and the next steps to the cost board at their October 23rd meeting. And thank you all so much for attending. The recording and summary of this meeting will be posted shortly on our website, and the October 2nd nominating committee meeting is now adjourned.
Thank you. Thank you both.
Thank you.
Okay.
Thank
See
you.
you later.
Ingrid and Kim, is there any willingness to reach out? I just want to make sure that these materials are meeting your needs. If that'd be okay, just to connect to see what improvements we could make to kind of provide the additional context. Thank you very much.
Happy to do that. And Carol, I will not be at the October 23rd cost board meeting. And so I'd like to just share my gratitude and for all your contributions and your willingness to serve so many people for over the years. And, just wish you a fabulous next chapter.
Oh, thank you, Kim, so much. And on a different platform too, I'm so sorry to miss next week's meeting with Ellen and I too.
Oh, yes, yes.
Yep, different context. I know,
That's
I
right.
know.
Yes, yes.
Yeah, I thought our paths would interact again, but sadly, I've
That's
got to
right.
be
Okay,
keeping that.
Carol, no worries.
Yeah, so thank you so much for those kind words. I too have appreciated working with you, Kim, and Ross, Michelle. Thank you so much for all your support, all that you do.
Yeah,
Thank you so much. Yeah, wish you the best, Carol, and look forward to seeing you at the cost board meeting. And then, if you don't mind, we'd love to say acknowledge you if that would be okay at the next meeting. Okay.
Okay, that's fine. Not my preference. I prefer just kind of quietly stay away. But yeah, thank you. I hope you all have a great day.
You
We'll
too.
see you then.
Take care.
Thank you.
Bye.
okay.